JBN, we keep you informed. Clarendon couple wounded in attack. A man and his common-law wife were shot and injured by gunmen in Hayes, Clarendon on Thursday night. Their house was also firebombed. Shortly after 11 o'clock, their house was sprayed with bullets and then set on fire. The couple is in serious condition in hospital. St. James woman charged with murder. A 27-year-old woman of Richmond Hill, St. James, has been charged with murder following an incident that took place on Queens Drive, Montego Bay on Thursday, April 16. According to reports from the Montego Bay Police, Elishel Hall and 23-year-old Peter Gay Deans, a masseuse of Linders Road, Kingston 5, had a dispute. During the altercation, Hall allegedly used the knife to inflict multiple stab wounds to Deans. The police were summoned, and upon their arrival, Deans was assisted to the hospital. She died while undergoing treatment. Hall was subsequently taken into custody and charged. Her court date is being finalized. Motorcyclist dies after crashing into pole. A man has died as a result of injuries he sustained in a motorcycle accident on the Watchwell Main Road in Pedro Plains, St. Elizabeth on Friday, April 17. He is 30-year-old Kemar James, a farmer of Newell District in the parish. According to the Black River Police, about 5:30 p.m., James was driving a motorcycle along the roadway when he reportedly lost control and crashed into a utility pole. Passers-by alerted the police, and James was taken to the hospital where he succumbed to his injuries. Lucky charged for St. James double murder. The police have charged 19-year-old Sheldon Bailey, otherwise called Lucky, of Norwood, St. James, with 2 counts of murder and illegal possession of a firearm and ammunition. Bailey was charged following the shooting death of 33-year-old Dane Walters, a mechanic of Hendon, Norwood, and 48-year-old Rodrick Atkins, a construction worker of Hollywood District in St. James. Reports are that about 1:25 p.m., Walters and Atkins were sitting at a corner shop in Hendon when 2 armed men alighted from an AD wagon motorcar and opened fire, hitting them both. Residents summoned the police, and the men were assisted to the hospital where they were pronounced dead. Following investigations, Bailey was subsequently charged on Friday, April 17. His court date is being finalized. Ewarton resident test positive. Family bashed. A family in the Ewarton area, St. Catherine, has confirmed that a loved one who works at a Lorica call center in Portmore has tested positive for COVID-19. The matriarch of the family said her daughter has been in isolation at the Spanish Town Hospital and her condition is not considered severe. She added that her daughter sometimes travels from the Ewarton area to work in Portmore, but she mainly stays outside the community in order to reduce travel time. The mother admitted that her daughter was with the family in Ewarton when she started to feel certain pains. The other day she was there, and her period did upon her. She in pain, but she have high blood pressure too. So she go back to work this Saturday. Same time them hear about the virus, her pressure fly upon her, almost give her a stroke. And then rush with her to the hospital. When them test her, them say them find like a corona in her. She not come back here in Newton, the mother added. She stated that the other members of her household, including children, have not been showing any COVID-19 symptom. The mother said she has been trying for days without success to have her family tested. Me call the help people them and tell them and them no come. Them say me fi stay and watch for symptom and no come out of my yard. So we stay in the yard, she explained. The mother stated that if the health authorities don't show up by Monday, she'll have to travel to have the test done at the Linstead Health Center. She in the meantime lamented that a number of people, especially in her community, have been stigmatizing and chastising members of her household in person and via telephone. The mother said the critics have accused her family of possibly having COVID-19 and refusing to report to the health authorities. In the meantime, the first Alorica worker locally to have tested positive for the highly contagious virus is also from the Ewarton area. She too is in isolation at the Spanish Town Hospital. An outbreak of the virus at Alorica in Portmore has resulted in 84 workers so far being tested positive for COVID-19. It also led to a shutdown of the entire parish of St. Catherine for 7 days. Unanswered questions surround the virus-positive TCI patient that sent UWI hospital staffers into quarantine. The University Hospital of the West Indies is being overly cautious about the circumstances that sent a senior doctor and the likely other healthcare workers on the front line of the COVID-19 fight into quarantine after a critically ill patient from the Turks and Caicos Islands, TCI, was readmitted to the facility on April 16 and later tested positive for the deadly contagious disease. The hospital is the region's leading referral medical institution. The male patient arrived at the Norman Manley International Airport in Kingston Thursday night on board an air ambulance. Minister of National Security Dr. Horace Chang has confirmed. He was later transported to the hospital in St. Andrew, where he tested positive for the coronavirus disease, COVID-19, the hospital admitted. The hospital issued a statement yesterday afternoon after questions began swirling from early morning about their situation, which is reported to have exposed several top-ranking staff, including Professor Joseph Plummer, who is the head of surgery, and a member of the institution's 56-member COVID-19 response team. But it was the questions not answered by the hospital that have led to even more questions. The hospital's head of public relations, Nordia Francis Williams, said the institution is refraining from answering questions and will speak further next week. The statement did not address the number of persons involved in the pre-positive care of the patient, and even though it started off saying it wanted to correct information circulating, it did not address reports that Professor Plummer was in quarantine. It did not say where the TCI patient was housed while test results were pending, and neither did it say if any new protocols will be implemented as a result of the developments. Whether it explicitly sought the COVID-19 status of the patient ahead of arrival was also not clear. According to the hospital, the patient was screened based on the hospital's screening form and at no time was considered to be COVID-19 positive, although it is not clear whether there are special protocols for overseas cases coming from countries where the coronavirus disease is confirmed. Turks and Caicos had 11 confirmed cases of the respiratory illness up to Friday, according to information on the territory's government website. The hospital said the COVID-19 test was done here out of an abundance of caution. The Medical Association of Jamaica declined to comment on the issue, but the Nurses Association of Jamaica said, while it is not overly concerned now, the hospital must have knowledge of patients' COVID-19 status ahead of their arrival. The safest thing to do when we are taking patients from across borders is to ensure that we have a COVID test for those individuals, said Carmen Johnson, the association's president. She said the organization has not been able to determine the number of nurses who may have been exposed and therefore those who may have to be quarantined because, according to her, the hospital was still doing a risk assessment. Regarding the patient from the TCI, the hospital explained that the individual was treated there for gastric cancer on March 16 and returned home on March 26. It said following an emergency operation in the TCI, a request was made to the hospital for additional treatment and was discussed with the Ministry of Health's Emergency Operations Center, the Ministry of National Security, and the Jamaica Civil Aviation Authority. Although Jamaica's borders are closed to incoming passenger traffic, the Cabinet can approve exemptions recommended by the National Security Minister, Dr. Horace Chang, who confirmed that he did. Sources say weeks ago, the hospital rolled out a 67-page document which served as the driver of the institution's response to the virus. The document, with a March 23 revised date, is titled COVID-19 Specific and zoomed in on, among other things, patients who are suspect or about whom there were suspicions. Among the protocols in place at the hospital for suspect patients are individuals transferred to UHII from another facility are escorted from the ambulance to isolation unit. The transferring team must escort patient into isolation unit wearing PPE, personal protective equipment, for contact and droplet precautions, and contact should be made with the emergency medicine physician on duty. However, The original plan was largely centered around individuals who visited China or were in contact with Chinese subjects. The plan was subject to amendment as the situation changed. According to its protocol, confirmed positive patients transferred to the hospital should go directly towards 7 or intensive care units. The hospital's checklist for positive patients' referral and admission is outlined and said, severe acute respiratory illness with actual or impending respiratory failure and confirmed COVID-19 infection who will benefit from ICU care. Yesterday, Health and Wellness Minister Dr. Christopher Tufton on social media said the situation at UA was a medical emergency and sometimes we have to help out and sometimes there will be situations where we'll need to make exemptions. JBN, we keep you informed. Please remember to subscribe, like, share, leave us a comment and click the notification bell to receive our daily news items.